We have all experienced that diseases like parvo and panleuk and distemper can be absolutely life-threatening in our shelter populations, and our puppies and kittens are the most vulnerable to these dangerous diseases in shelters. Now, we all know that one of the pillars of disease prevention is vaccination, and so I am so excited to share with all of you a life-saving update that we hope will improve the health and survival of neonatal puppies and kittens in our care. I'm Dr. Erin Katribe, and in our team, the National Shelter Medicine team at Best Friends, works with shelters across the country. And this is a practice that's been working successfully at many shelters since it was introduced. And we now have an expert recommendation for this practice more broadly across shelters. So today, we're talking about neonatal vaccination. And yes, when I say neonate, I mean as young as a day old. So let's dive in. We have these updated recommendations for vaccination from the University of Wisconsin and the UC Davis Shelter Medicine programs. This is to reduce the risk of disease in our puppies and kittens. So, when meaningful risk is present, vaccination at the earliest possible time. So, what does earliest possible time mean? So, this means the moment that we have our first opportunity, regardless of age, including neonates. This means in practice, vaccination as early as day one if they're born in our care, or at the time of intake, whether they're 3 days old, 3 weeks old, or 3 months old. And this is a change from previous shelter recommendations to start at 4 weeks of age. And our primary strategy of getting them out of the shelter facility. So minimizing exposure should also be used in combination with this earliest possible vaccination to the greatest extent possible. This means the strategy we've always relied on of getting them out of the shelter facility and into lower risk foster homes, that should be used as much as we can whenever it's possible. But unfortunately, the reality that we're facing everywhere is that we're just not able to find foster homes like we used to. And sometimes those puppies and kittens have to stay in the building. Or sometimes the foster home, if it looks anything like my home is a foster home with multiple litters of animals or potentially sick animals like sick kittens, arguably there's meaningful risk in those situations too. So again, the recommendation is when meaningful risk is present, both vaccination at the earliest possible time and minimizing exposure to those diseases, meaning getting them out of the shelter facility if we can, but both should be used in combination to the greatest extent possible. So, what is changing? We will vaccinate puppies and kittens at the time of intake, regardless of age, or at the time of birth in Best Friends Life Saving Centers, and this recommendation applies across shelters. Why the change? This is an instance of balancing risk with potential life-saving benefit. And so what we want to look at is what is the actual risk of implementing this practice versus what is the potential life-saving benefit. And what I would argue is that the life-saving benefit far, far, far outweighs any potential or even theoretical risks. We know that the risk of infectious disease in our shelters for parvo and for panleuk and for distemper is very, very, very high. What we also know, what we're learning, is the likelihood of pre-existing immunity in puppies and kittens or even in adult animals entering our shelters is actually pretty low. And I'll show you some data that supports this. So what this means is that animals coming into our shelters or animals being born in our care are unlikely to have pre-existing immunity to these dangerous infectious diseases. The risk of adverse effects is very, very low. So the risk of adverse effects associated with vaccination in general, and even in our neonates, is very low. So let's look at that pre-existing immunity. One study looking at shelter dogs found that nearly 2 out of 3 dogs entering shelters were unprotected for canine parvo, for canine distemper, or for both. And intact dogs were at higher risk than those that had been spayed or neutered. A study of shelter cats found that 60% of those cats entering shelters, and this includes adults, so 60% of all cats were unprotected from feline panleukopenia virus upon entry to the shelter. Intact cats also at higher risk than those that were coming in spayed or neutered. And then finally, community cats. So a study of trapped cats that were presenting for sterilization through a TNR program found that 67%, nearly or more than 2 out of 3, were unprotected from panleukopenia. Okay, so cats and dogs are entering shelters unprotected, and intact animals are more likely to be unprotected. And where do puppies or kittens come from? And by definition, right, they come from intact animals. And so if we're looking at our shelter populations, by and large, those moms are not protected. And so they're not passing on any maternal antibody to their offspring. And so those puppies and kittens are going to be unprotected. Puppies and kittens born to shelter moms are less likely to be protected, right? And so this is what makes this recommendation, this vaccine recommendation, different than those for general practice, where owned pets that are coming into clinics and in scenarios where there is adequate access to vet care, those puppies and kittens are much more likely to be protected because their moms are more likely to be protected. All right, one question is, can neonates actually respond to vaccines? So one past critique of this practice that was often repeated, including by me, was that neonates' immune systems couldn't respond. But it turns out, when you actually dig into the literature, we find evidence that they can respond. So this study looked at the ability of neonatal puppies to respond to vaccination, and the author was able to safely vaccinate groups of 1-day-old puppies with a modified live canine parvo vaccine. None of the puppies had adverse reactions to those vaccines. And immunized puppies developed and maintained antibody levels steadily over the course of 3 months, while the unvaccinated control puppies actually had maternal antibodies that waned steadily over time, and eventually those unvaccinated puppies became unprotected. I would also note this is a widely accepted practice in human medicine. We commonly vaccinate human babies as very, very, very early. Okay, is it safe? Let me share with you some of the data that we do have from organizations that have been doing this for some time now. So San Diego Humane Society is one example, and they vaccinated over 500 puppies and over 1,300 kittens at the time that we collected data with no adverse effects reported. Other organizations, we don't have quite the robust counts as we do for San Diego, but organizations like Austin Pets Alive, Rural Area Veterinary Services, and our own Best Friends Navajo Nation Outreach Program have been utilizing this practice. And there are many, many, many more examples of shelters out there with no adverse effects. Okay, so there exists this concern, particularly in kittens, about cerebellar hypoplasia. But this risk has actually not been documented, and this is really a myth. It's based on one case study where a pregnant cat that was vaccinated gave birth to kittens that had CH. But the authors of the study even say that this cat, who came in as a stray, was likely actually infected with panleuk before she came in and before she was vaccinated and before she gave birth, and that this was not because of the vaccine. And so what we do know is that the risk of parvo, distemper, and panleuk in the shelter is very real, and that this risk associated with neonatal vaccination is actually theoretical and was based on a case study in a pregnant cat, not even talking about actually vaccinating neonates. And so again, we're back to this idea. This is about balancing risk and benefit, and we know there's a very real risk of infectious disease that can be fatal even with all the resources in the world and even with intensive treatment, compared to the risk of vaccination, which is next to zero. Okay, so are they considered safe now that we're vaccinating them? And I would highlight that this does not replace the need to get our puppies and kittens into foster care and out of the shelter for disease concerns as well as for socialization and behavioral welfare. So does anything change regarding biosecurity and PPE precautions? And the answer is really no. So that really the only substantial risk with this practice is that we think they're protected. Some of them will be protected by that vaccination, right? That's why we're doing it, but many of them won't be. So for all of those puppies and kittens that did get antibody from mom, that antibody from mom is going to wear off at some point, leaving them vulnerable until they get the next vaccine, and that vaccine has had a chance to kick in. So this doesn't change anything about how we handle them in terms of disease risk. And it also doesn't change that we don't know what happened to them the day before they came into the shelter. Were they already exposed to one of these diseases, right? They look healthy now, but are they about to break with parvo or panleuk or distemper? And remember that we wear personal protective equipment, so gloves, gowns. We wear it not just to protect that puppy or kitten from getting sick, from us causing them to get sick, from us transmitting that disease, but we also wear that PPE to protect ourselves from becoming contaminated and transmitting the disease that puppy or kitten might be shedding, getting it on ourselves and transmitting it to another vulnerable pet. So puppies and kittens are still considered vulnerable until they're greater than 20 weeks of age. Okay, so to recap our vaccination strategy at Best Friends, as well as what we're recommending broadly across shelters. So who gets vaccinated? Puppies and kittens coming in at 4 to 6 weeks of age or older, definitely. We've always vaccinated them. We will continue to vaccinate them. What about pregnant moms, nursing moms? They also get vaccinated. What about puppies and kittens or cats and dogs with signs of mild illness or even moderate illness? And the answer is yes, they also get vaccinated. And now, when we're talking about neonates as early as 1 day old, do they get vaccinated? And the answer is yes, they do. So to answer the question, who gets vaccinated? Essentially, it's everyone. If there's meaningful risk in our shelters and our foster homes, then we need to be vaccinating them. And in our settings, arguably, there's always meaningful risk. If you want to learn more, I highly recommend you check out the official document from the University of Wisconsin Shelter Medicine Program. And so you can see that document here. It's accessible online. And if you need help, feel free to contact our National Shelter Medicine team via this form. This goes for anybody out there working in shelters, as well as for Best Friends staff that are working with shelters. And if you need sample medical protocols, including updated intake recommendations, updated intake protocols that include neonatal vaccination, get some samples there at that second QR code.